everybody, gather near. The doctor's in the house, so lend him your ear. The things he could say might even make your day. He might even help your pain go away. The doctor is in the house. The doctor is in the house. Let the doctor know what's bothering you. I'm sure he can tell you just what to do. The doctor is in the house. Doctor is. Hey, ladies and gentlemen, this is Dr. Ron, and I am in the house today with lots of little complications with electronics, but we're going to get through this today. Welcome, everybody, and I hope you're having a great day. And in our 575th podcast today, we're going to tackle neuropathy as best we can so that I can give you some ideas to think about. We'll explore some of the causes, some of the symptoms, some of the treatment options, especially the alternative ones, and try to shed some light on this seemingly increasingly popular diagnosis. So we'll try to shed some light on it, and if necessary, we will get a specialist in here to further elucidate the problem. But remember, we live in a world where medical error is one of the leading causes of death. So I'm just going to encourage you to do your own research. I'm going to encourage you to do that because the American Medical Association, which owns the Book of Diagnoses, where they're the codes that doctors use to bill for their visits, they have over 40,000 different diagnoses they can pin on you now. So they really have expanded that, and you always have to go back to what was the cause, what was the splinter, what was the initiating factor to cause this neuropathy. I guess you can hear my phone going off here. So I tried to elucidate the meaning of neuropathy. It just means nerve pain, and it can be caused by various etiologies. The word neuro is a prefix from the Greek and means nerve, and pathy is a suffix from the Greek where pathos, it means suffering. So neuropathy literally means nerve disease or nerve suffering. And everybody I hear that has this diagnosis is indeed suffering from this pain. And this condition affects the peripheral nerves. And those peripheral nerves are responsible for transmitting signals between the brain, the spinal cord, and the rest of your body. And when they're damaged or dysfunctional, well, everybody that's suffering from it knows that the symptoms that can come from this, which include pain and numbness and tingling and muscle weakness, which causes imbalance and loss of something you don't hear talked about enough, proprioception. That's your body's position in space. The best analogy I can give you is if you're driving your car and the speed limit is 35 miles per hour, and then it goes up to 55 miles per hour, you automatically push that accelerator down a little bit more, not thinking that it's going to be an inch, a half inch, a quarter of an inch, but you're going to pick up speed. So the causes, the etiology of this diagnosis of neuropathy are quite diverse. They can be metabolic. They can be autoimmune. That's where your body doesn't recognize its own nerves. It could be trauma. Of course, the most common cause is diabetes and diabetic neuropathy because of prolonged high blood sugar levels. But toxins can cause it. Vitamin deficiencies, such as vitamin B12, alcoholism. There are certain medications, certain physical trauma, including multiple surgeries, rheumatoid arthritis, lupus patients can have neuropathy. Shingles can cause neuropathic pain, which can develop into chronic neuropathy. So can Lyme disease. So can certain vaccinations. So one of the main things that your primary care has to do is get the diagnoses, identify the signs and symptoms and where they're coming from. And it's complex. I'm not saying it's easy because, the symptoms are all around the place with numbness and tingling, etc. So a complete history and physical examination are important. And diagnostic testing is important. And these tests could be blood tests, especially for diabetes. But I don't see enough blood tests for vitamin deficiencies. In my experience here in Florida, I don't see enough use of the EMG or electromyograph to assess, it checks out the electrical activity of muscles and nerves. It can determine nerve conduction, that is, how fast the nerve conducts signals, how fast these signals are traveling. I don't hear much about nerve biopsies, but the earlier you can diagnose it, of course, the easier it will be to treat. And treatment, again, is multifaceted because there are many things that can cause neuropathy. If it's a vitamin deficiency, it's treatable. If it's diabetes, you can address the root cause, get your blood sugar under control. Pain management. That's an interesting word, isn't it? The two words, pain management. It's not pain curative, just manage the pain, huh? Well, you really want to try and get to a healer that can cure the pain, not just manage it. But it is a priority. And of course, the allopathic physicians will use a wide range of medications, some of them quite toxic, like antidepressants. They won't use the older anticonvulsants like Dilantin. They'll use the newer ones, which, in my opinion and experience, are not as effective. There's topical treatments we can discuss. Physical therapy is important. Lifestyle modifications. I don't hear enough talk about advising on a diet, like a gluten-free diet, avoiding alcohol, dealing with stress. I don't hear enough about acupuncture in the treatment of neuropathy. I don't hear enough about herbal supplements being used. I don't hear enough about mind and body techniques like mindful meditation and relaxation exercises. I hear some about massage therapy. I don't hear enough about electrical nerve stimulation in the form of transcutaneous electrical nerve stimulation, which is called a TENS unit. And of course, there are units that are stronger than the TENS. I don't hear enough about using chiropractic care for the musculoskeletal disorders and the spinal manipulations that they can do to take some of the pressures off of these nerves. I don't hear enough about biofeedback therapy. I mean, these are all treatments that you should be discussing with your healer so that you can get rid of some of this pain and numbness and life-altering way of living with this pain. One thing I never hear about, and which is really important, is mitochondrial dysfunction. I've talked about the mitochondria many times on this program. They are the powerhouses in our cells. And when they don't function properly and malfunction, you don't have energy production. And lots of bad chemicals build up in the cells and cannot get out. We'll talk a little bit about that. We'll talk a little bit about protein misfolding. You hear it in certain diseases, but those that have misfolded proteins like amyloid, that can impair the supply of blood. I again want to mention, because it's in my notes in big letters here, gluten-related sensitivities. It would not hurt to go on a gluten-free diet for 2 or 3 months. We know that infections from viruses, like I said, the shingles virus and the Lyme disease virus can cause neuropathy, but how about COVID-19? How about the genetically induced shot that was given to everybody to treat that? Because peripheral neuropathy has been reported after these shots. And ask your healer to ask you to see if he can investigate toxic exposures. Maybe there's some chemicals you've been exposed to, certain medications that can damage your nerves. Have you been on chemotherapy? Long courses of antibiotics, antiviral drugs. They all can affect your nerve. How about heavy metals and solvents and pesticides? Well, pretty hard to avoid them in this toxic world we live in. We'll talk a little bit about vitamin D, because that's something that has been found in many studies, in especially diabetic patients that have neuropathy. But remember, there's no money to be made in vitamin D, so you don't see the pharmaceutical companies studying that. Vitamin B1, it's called thiamine. I always recommend benfotiamine, which is fat soluble. But you can be checked for these vitamins, especially D is easy. B12 is easy. But deficiency in D, B1, B12, E, copper, and folate can lead to peripheral neuropathy. So, I know this is something that's difficult to deal with, and so is the diagnosis of it. And of course, the older we get, the more we are at risk of developing this diagnosis. More in men than in females. Taller people more than short people. So I encourage you to make sure you go to a physician, a healer that will investigate your history and talk to you about any toxicities you could be in contact with or have been in contact with, any shots that may have affected you, any surgeries that you have had. And do talk about electrodiagnostic testing like the EMG, the nerve conduction study. Of course, everybody's used to ordering imaging studies, but there is an ultrasound test that they can use over the peripheral nervous system beside the MRIs that you hear about. So if you've been injured, you've had a fall, you've had any foot ulcers, you've had any damage to your autonomic nervous system, that's the one you cannot control, like irregular heart rate, blood pressure problems, digestive problems, difficulty swallowing, that all should be investigated for peripheral neuropathy. The treatment will be easy if you can find the cause. And beside the pharmacological treatment of neuropathy, there is the lifestyle changing methods. And a couple I want to bring to your attention now that you won't hear generally. I want to talk to you about zymescence. It's the strongest systemic enzyme you can buy. It is anti-inflammatory, anti-fibrotic. So if you've had injuries and multiple surgeries, zymescence would be a supplement that your physician should recommend to lyse, to break up that fibrotic tissue. Another therapy that is really invaluable for neuropathy is red light therapy, and combine that with methylene blue. Now, you won't hear this generally from your normal allopathic physician, but this low-level laser therapy, photobiomodulation as we call it, it's non-invasive. It uses the wavelengths of near-infrared light, usually around 680 nanometers, and it stimulates your mitochondria that are producing the energy you need to keep you healthy and heal and have energy in your body. There are studies with red light therapy that it can reduce your pain and improve sensory function. And methylene blue. You won't hear a lot about this either because it cannot be patented. It's a synthetic compound that most of my listeners and my family use on a regular basis. Why? Because it stimulates the mitochondria. It is neuroprotective. It has properties that are neuroprotective. It helps the mitochondria breathe and make more energy. And when you combine that with red light, it's a home run. So combining red light therapy and methylene blue. Together, these treatments may help improve nerve function, reduce pain, and promote nerve regeneration. With the one side effect is they cost money. And fourth thing that I would like to mention is Easy Trek. We had Brian Peskin on the program a few weeks ago, and he is the godfather of parent essential oils. He's probably the only one that really understands lipids. As we talked about in the past, most of the fish oil supplements are toxic with pharmacological doses way above what your body needs. Your body needs physiological doses. And what happens with them? They become adulterated. They clog up your cell membranes so your cells cannot get good products in and can't get the waste products out. But supplements like parent essential oils or the Easy Trek pharmacological dose of these oils can help these cell membranes recover. They can more effectively work. And we've seen some incredible results with people using this. Again, I don't have anything to do with the company. I'm just reporting what, I interview here on my podcast. And I do use Easy Trek. I do use zymescence. I do have red light. What else can you do? Sure, you could try capsaicin cream made from chili peppers. There's some good articles out there that it works by affecting some neuropeptides that are involved with sending pain signals to your brain. Some essential oils like lavender, peppermint, and eucalyptus While you're meditating, you could do some aromatherapy with those. And you can also apply some of them topically. We may have time to talk about alpha lipoic acid, ALA. They even use that intravenously. In very, very severe cases, hyperbaric oxygen therapy. But less expensive method of loading your body with oxygen is ozone therapy. And I think we should have Tobias back on my program to talk about ozone. That's another thing that the Repacies do. We use ozone therapy on a regular basis. Now, I do have experience with prototherapy. Dr. Nick Sergio is a prototherapist here in Naples. I have not seen or nor referred anybody to him for neuropathic pain. When I had my sciatica, he did help me with prototherapy, but I don't know. I can't really recommend it one way or another, except the literature does show that this type of injection, which is usually dextrose, sugar, into your ligaments and tendons and joints, helps the body's natural healing process and may strengthen and stabilize the joints so that they don't rub the nerve. So there's numerous therapies, not just taking drugs or just going to therapy just for the sake of doing it. So these last ones I mentioned, I really think are important. And you should have a discussion about systemic enzymes, zymescence, methylene blue, red light therapy, parent essential oils, and supplements if the test shows that you need them. I will tell you that from 2015, there was an article that showed a significant improvement in diabetic neuropathy with vitamin D supplementation, whether or not the subjects were exposed to sunlight. Now, vitamin D is a vitamin that is easily diagnosed with a blood test. And you don't want to be normal. You want to be optimal with the vitamin D levels. You want to be between 50 and 90. You don't want to be between 40 and 50. Because between 40 and 50, that's considered normal. But you don't need normal. You need optimal. The sad part is you won't see large clinical trials of vitamin D because they have to be funded by the government. Pharmaceutical industry is not going to fund them because they can't make money from vitamin D. It's too cheap. So you have to have a conversation about vitamins and minerals. I probably should list them. Well, I've been talking about them. So I guess the one you probably were not familiar with was benfotiamine. That's the synthetic form of vitamin B1. It's better absorbed than regular thiamine. And it has the potential to reduce nerve pain and improve nerve function. Now, here in the people that I associate with, a lot of epidurals. Well, let me just tell you that there are physicians in the field of regenerative medicine who use everything that I've talked about, including hyperbaric oxygen, which I would put in parentheses ozone therapy. They use also something called hydrodissection. And sometimes they go into the cauda equina, which is at the base of the spine where all the nerves come out. And sometimes they cut certain nerves and inject that area rather than trying to be specific with one area in the spine. Like I I hear people say, well, I had my L4-5 injected. I had my L5S1 injected. Well, they go and try and do them all at once. So it's just another strategy you want to think about. Hydrodissection. It's a skill that has to be learned, usually done by anesthesiologists. And it uses ultrasound to locate the nerves so they can have a more precise area to deliver the medication. Wow, I can't believe it's that time already. So, ladies and gentlemen, neuropathy does not have to be a life killer. There's lots of therapies out there. And there's the therapies that are out there that no one talks about, like systemic enzymes, like Easy Trek, like ozone, like red light therapy, benfotiamine, vitamin B1, prolotherapy, high concentrations of a dextrose solution, vitamin D, alpha lipoic acid, capsaicin cream, a gluten-free diet, getting rid of sugar, processed foods, and appropriate vitamin care, supplementation, chiropractic care, mind and body care, acupuncture. All those are in play so that you can get your life back, so that you can exercise regularly. And just remember, I know there's a lot of golfers and tennis players. Please be mindful that repetitive motions or prolonged positions that you could be in that could compress nerves, specifically that rotary motion, that rotation of the spine that occurs in a golf swing. Be careful. So I hope I shed some light on neuropathy today for you. I really appreciate you letting me in to your ears. And I hope to bring you interesting topics. I was going to talk about energy today, but I heard so much about neuropathy over the weekend, I decided to throw this in. But we'll talk about fatigue next week. Why is everybody so tired? Could it be that their mitochondria are damaged? Huh? Okay, ladies and gentlemen, have a great week. And this is Dr. Ron closing out. And we are on BitChute, Rumble, LinkedIn, Spotify. Listen to us on Spotify. We're getting a nice following there. Apple Podcasts. We're just about most places that you can listen to a podcast. And the podcast is called Dr. Ron, Unfiltered, Uncensored. And our listeners are called Medical Warriors because we're at the front line of staying healthy so we can protect ourselves and our families no matter what is thrown at us. And remember, the biggest virus of the past 5 years has been fear that has been generated through the television. Don't succumb to fear. Keep your interior superior, which means keep a good gut microbiome, have a great positive attitude, and you can be a wellness warrior. Have a great week.
Hey everybody, Dr. Ron's finished for today. I hope you got some good wisdom for what the man had to say. If it's all about good health, he's the man you got to see. He has a lot more answers for you. So tune in next week when the doctor is in the house. Or when the doctor is in the house. And let the doctor know what's bothering you. When the doctor is in the house. The doctor is in the house. Doctor is in the house. Let the doctor know what's bothering you. I'm sure he can tell you just what to do. The doctor is in the house. The doctor is in the house. Let the doctor know what's bothering you when the doctor is in the house. So if you have a pain, call the doctor. If you have a strain, call the doctor. Let the doctor know what's bothering you when the doctor is